Hey everyone, welcome to Meddkit's Provider Spotlight, where we are interviewing amazing private practices and practitioners from all over the United States. They are amazing, incredible human beings, and we are so excited to tell their story. And so today we have a really amazing guest, Dr. Kristin McConnell, all the way from sunny California. Dr. Kristin, welcome.
Hi, Rachel. Great to be here.
So good. I'm so excited to dive in, and I know you have a lot to share. So let's get into it. So tell us a little bit about your story. Tell us what inspired you to open up your own practice.
Yeah, so it's maybe a bit of a long story. So my story really to starting to opening up my own practice starts before I even knew what occupational therapy was. I studied international relations for my undergraduate degree, and I really always had this dream of helping people and wanting to have impact. But it was always like I wanted to have impact in this really big way. Like I thought about countries or conflict resolution. And so that's what I started off being really interested in. And I was having a hard time finding a job where I could actually have that impact that I could feel. So after college, I ended up taking a job in corporate consulting, which is kind of maybe unexpected. So just that first job out of college, right? And I became really, really, really burnt out. It was not the best fit for me. I really had a hard. I wasn't practicing self care. I was kind of just burning the candle on both ends, working really hard, and feeling like really disconnected from my work at the same time. So I started just having a lot of issues, mostly with my mental health, but was having trouble sleeping, having a lot of anxiety, um, just felt really stuck. And it was during this time that I discovered yoga. And I really dove into my own yoga practice. And this was just such a refuge for me at this time. Just like having this space where I could go to be with myself, to focus on my breath, to really start to feel my body in new ways, like opened up this whole new world. And it was this first spark within me of really like wanting to prioritize my own health, but also like I was like, hey, I want to help other people like feel this connection to their body and discover this connection to themselves. And so it was like against this backdrop that I learned about OT from a friend, and I just really immediately connected to the philosophy of the profession, its emphasis on adaptability and really like resiliency, like humans' ability to adapt in the face of challenge. And I loved how broad it was because I still didn't really know what I wanted to do. But I was like, seems like a broad enough umbrella that I could kind of, throw a little yoga in, throw a little, what all this stuff that I'm interested in. I can kind of put it under this umbrella. Um, so yeah, it just resonated. I think OT resonated with a lot of what I was experiencing in my own life. That like as I was focusing on how I spent my time and how I was taking care of myself, I started to feel so much better. Um, so from there, I took action. I took a really big leap of faith. I left my corporate job. I enrolled in a yoga teacher training. I moved across the country and I started my prerequisites to go back to OT school. I had never seen myself working in healthcare. So I had to go back to school and like do anatomy, physiology, do a lot of these prerequisites. And I knew that I wanted my focus within OT to in some way be in this field of health and wellness. So that's what led me to the University of Southern California. USC has a specialty area in OT called lifestyle redesign, which is all about how we build and implement health and well-being through our habits and routines. So that in particular, like really drew me in. Um, so I did my training at USC, did my master's degree, and I ended up completing my doctorate specializing in lifestyle redesign.
You're a busy
Um,
man.
yeah, I was like, if I'm going back to school, I'm just gonna do it all right now, right?
No,
It's
I
like,
love it. You were like, okay, corporate refugee. That's what I like to call them. corporate
Yes.
refugee, and I am going to beeline it to my passion, and I'm going to take it all the way. So I love that you were like, okay, I'm going to go to USC, and I'm not just going to, take all these classes and prerequisites. I'm going to get my master's, and then I'm going to get my doctorate. So I love that you took it to the nth degree
Yes.
early.
Yeah. Yeah, yeah. And so my doctorate, USC has a clinic that specializes in delivering lifestyle redesign. So I spent that year working with all different kinds of patients, delivering lifestyle redesign, everything from college students who are struggling with mental health and time management to people who are managing chronic pain, migraines, like autoimmune conditions. So really like a wide variety, right? People managing a lot of medical complexity and then mental health and kind of wellness promotion. And across that spectrum, I saw how working with people on these pillars of building a healthy lifestyle, so helping them focus on improving their sleep, getting consistent movement, managing their stress, social connection, like all of those things helped everything from like reducing symptoms of multiple sclerosis, reducing pain, to like reducing anxiety. It was like, oh, this is the foundation that really all of health is built on: physical health, mental health. And I just love that. And I thought it was so cool that, like, if you could really help people, I almost think about it as the foundation of a house, right? If you build a really strong, solid foundation in these basics, which I also always say it's like easier said than done. And
Yeah.
that's why I think like working with an occupational therapist to build these things can be so helpful. It's like we all know what we should be doing
Mm-hmm.
usually for this lifestyle, but it's really, really hard to actually do sustainably and consistently.
Yes. And
Um,
could you say, like, so one kind of like a common theme is that, like, one, being an OT, certified yoga teacher, and we'll also get, I'm very curious about the surf therapy. So we'll get into that. But if you had to like boil it down, OT in general, like what do you wish like people really knew about it? Like what is like the nitty gritty? Like if you could take one thing away from this conversation and understand OT, what would that be?
Yeah. Well, thanks for this question, Rachel. April is actually Occupational Therapy Month. So it's a great month to like share a little bit more
Yeah.
about occupational therapy. It's really not well understood. I think
Yeah.
even the name is confusing. So sometimes people think that I help people get jobs or help them return to their job. Or you might associate OT with like rehabilitation that happens inside of a hospital. So, if there was one thing that I wish people knew about OT, it's that we are a truly holistic profession that looks at the mind, body, spirit connection and how that's related to health. Our training is incredibly holistic. In addition to training in anatomy, kinesiology, like physical rehab, we also do in depth training in mental health, human development, therapeutic communication. So, like, yeah, it's super
So
broad.
crazy. I no idea. That's amazing.
Yeah, yeah. And so I think our differentiator is that as occupational therapists, we're experts in occupation, and we define occupation as the meaningful activities that occupy your time. So really, I mean, that's everything, right? That
Yeah.
includes everything from like self-care activities, like taking care of your body, showering, getting dressed, to sleeping, to engaging in hobbies or leisure. So for me, I love to surf, I love to do yoga, I love to be outside. Um, those are all occupations that help me feel like myself, right? They contribute to our sense of identity, they contribute to how we organize our time, and they're related to our health. And so occupational therapy is all about helping people fully participate in their life and engage like to the fullest extent in the activities that are meaningful to them.
Got it. And now taking that one step further, if let's say someone's talking to a friend and they're exhibiting some type of symptoms or they have some type of condition, when do you feel like it's appropriate for someone to see an occupational therapist, and what kind of conditions do you help treat?
Yeah.
Yeah.
Okay, good question. So two different parts. Maybe I'll take the first part
Yeah.
first of like when might you see an OT, and then we can talk about what I treat.
Yeah.
Um, so this one is interesting because I think there's like the way that I am working,
Yeah.
and a lot of maybe OTs who are running their own practices kind of a little more outside of the medical model. And then there's like the medical model.
Yeah.
So in the medical model, oftentimes people aren't really referred to OT until there is a very significant impact on their daily activities, right? Like it might be after they've had a stroke or after they've had a fall, like they're in the hospital and there's this huge rupture in their occupational life, right? So they need help getting into the shower. They need help with these really basic activities. In my opinion, I feel like this is like we're underutilizing OTs, right? We have this really holistic skill set that can even help like bridge the gap between all of this information that we have about the things that you could be doing every day to help improve your life. And then we have OTs who are really the experts in like implementing that and in helping you integrate that into your life. So to be honest, I think everyone could benefit from seeing an OT.
Yeah.
Um, right? Like, what do you have? What do you have a hard time doing in your day? What do I have?
Why are you waiting for the volcano to erupt to like feel better, right? You know, like if you could be already on your way to be solving some maybe basic problems, um, and
Yeah,
feeling more
yeah,
like yourself and getting back to the person that you were, you wanted to be, the person that somehow something along the way got a little, you know, and you're finding your way back. So yeah, why not wait? Why wait when you can go now?
yeah, yeah. And I guess, and I know that's a super broad answer. So if there's somebody out there who wants, more tangibles, I think like an OT is going to be great for you if you're having symptoms or you're having these things come up that you do feel like are impacting your day-to-day life. If you're feeling overwhelmed managing a like physical or mental health condition and your life at the same time, an OT is going to be a great support. If you're having a hard time making change in your life, right? So if you're that person and you're like, oh, I know there's all this stuff I should be doing, like, I know I shouldn't be on my phone scrolling before I go to bed, but I can't seem to stop and I'm not sleeping well. Um, an OT can help you, especially an OT that is trained in these modalities that are more lifestyle focused. So, yeah, you have to find that OT. I'm that OT if you want to talk. But an OT could be really helpful. Um, I I feel like there's definitely an overlap between occupational therapy and like coaching,
Mm-hmm.
right? But as OTs, our skill set is broader than that of a coach as well. So yeah, and then if somebody's managing like a different health condition, I always say like I think a lot of my clients they feel like they're seeing a bunch of healthcare professionals who are kind of just helping them with like one isolated thing. So they're going to like a doctor to help them manage one symptom. They're going to a PT who's helping them with their knee. They maybe have gone to a nutritionist who's helping them eat a particular way. Um, but they're still having a hard time like actually making change in their life. So the people they're working with might not be able to or have the time to like look at that full picture.
Yeah.
Who are you? What do you care about? What's your lifestyle? What's important to you? Where do you want to go? Um, and I think OT is great for that because we are looking at
Well,
all of it. So we're more of like we're kind of generalists. Um,
and I think it's
and yeah,
because, I find a lot of people who have multiple doctors, it's hard to make them all communicate together. And so this one's
yeah,
overseeing for that, and then it becomes a little disjointed, right? And so
yeah,
I think in their specialty, yeah, it's great. But when you're trying to make all these different things happen in work with different people, that can be kind of difficult. And I love that you kind of just pulled all those specialties together into one house, right?
yeah. And I definitely like there's definitely a place and a need for specialists. Right? Like, so not saying that I can replace all of those people.
Yeah.
I just think an OT is a great like functional support to your team,
Yeah.
right? So if you feel like you're just overwhelmed by healthcare, like your healthcare team, and you are going to the doctor and they're probably telling you to do a lot of the same things, right? But you're having a hard time actually doing it. I think that's where, particularly like lifestyle based OT can be really helpful.
Yeah.
Like, let's actually get you moving and get you started making some of this change that you keep being told to do, or you should do, but you can't figure out how to do it in a way that works for you.
Yeah, 100%. And before you kind of mentioned, finding an OT that has, other modalities to kind of aid people in their recovery. So I know I kind of mentioned a little bit early on, and I'm very excited because I have never heard of it before, but we mentioned surf therapy. And I know that's something that you do, and I know nothing about it. And I think there's a lot of people that probably would love to know more. It sounds really, really cool. So I'll kind of let you dive into that and tell us, how that helps folks.
Yeah. Yeah. So surf therapy is an emerging modality. There's a lot of different programs out there that offer surf therapy that might offer it in different ways, like a 1 day surf therapy camp, or so it's an interesting term. I think it means different things depending on how people use it because it's just new. Um, but what it means to me is that we're using the activity of surfing, or really like connection to the ocean. So an activity that helps you connect to the ocean. So I go back and forth. Sometimes I call it surf therapy, sometimes I call it ocean therapy, because I don't want people to think that it's like, it's not a surf lesson,
Yeah.
right? It's not really about the surfing. It's more about connecting to nature, connecting to ocean, through an activity that's going to support your therapeutic goals.
Yeah.
Um, so yeah, so I consider myself a surf therapy, ocean therapy facilitator, meaning that I'm really working with the ocean to facilitate an experience of connection and healing for my clients. My surf therapy, ocean therapy work is grounded. It's really grounded in like trauma informed modalities. So I incorporate a lot of mindfulness, somatic work, really like play, the experience of play, into being with the ocean. And I worked with an amazing organization called Groundswell Community Project, which has a surf therapy curriculum that's really grounded in trauma informed care. So that's kind of where I initially got my training in surf therapy. And then I also combine that with, my skill set as an occupational therapist, right? Because I feel like OTs are amazing people to do surf therapy because we have this activity, we have an occupation, right? Which can be the vehicle for somebody to build skills that will help them go where they want to go. Yeah, and there's so much healing that even comes from being at the ocean, from being in the ocean, from being really immersed in nature, and being invited to tap into your senses and experience that environment in a new way. So yeah, that's what surf therapy, ocean therapy
It
is
sounds
about.
so relaxing and fun and, just like a good chance to just get away and just kind of connect, just like what you were saying. And so I love that. That must be awesome. And I might have to travel all the way to California, test it out.
Yeah, it's a really, I think it's a beautiful complement to a lot of different kinds of therapy. I feel like it can be a beautiful complement to somebody who might have been in like talk therapy for a long time, mental health therapy. Um, it's just sometimes that like switch up of the environment, right? Like, let's get out of the clinic,
Yeah.
let's get off of screens. I do a lot of work virtually, like, so when I can, right, let's get off of screens, let's get out of the clinic, let's go somewhere out in the community together and experience it together, and even just be curious about like what comes up, what's this environment like for you. um it is very relaxing, right? There's so many things in the sensory environment when you're at the ocean that have a really regulating and calming effect on the nervous system. Um, but I'll say what I also love about surf and ocean therapy is that it's not just all about relaxation, because you can actually, like, there can be some fear that comes up. There can be some challenge that comes up, right? When you're working with this really dynamic, uncontrollable force that is the ocean. So that becomes really interesting to work with therapeutically also. Um,
Uh, I,
Especially if we're getting it like, let's get in the ocean. Let's like, maybe let's dunk our head under. Maybe let's like start to explore, like, are we going to take a board out? Are we going to manage the board? Right. So it's this, yeah, I could probably talk about it for a long time, but surf
I
therapy, it's interesting. It just invites in like all of these metaphors to work with and lessons that can kind of, you can work on them in like a laboratory, right? Like a surf therapy session is a laboratory, being at the ocean is a laboratory, but then it's like, oh yeah, actually I have that come up in my life as well. So what can I learn, like, in this really safe container at the beach with somebody who's trained to hold space for all of that, and really like meeting me where I'm at, that then I might pull a nugget from that into day-to-day life on land.
No, I love that. I'm such a beach lover that I didn't even think about the fear piece, but that's so true. A lot of people might have some, excitement or anticipation about getting into the water and, getting into the ocean. But I think like, yeah, that, things change and we have to deal with change. And I love that, it's such a safe place to do that and with your guidance. So I think that's really spectacular. I did want to dive into one more thing
Yeah.
before we leave off today. So, kind of, it's kind of been interesting, watching a lot of young people, getting diagnosed or having some like really rare, maybe like symptoms. And, I'm sure a lot of people come to you, then like kind of what you said, like they've been to other physicians, they've tried some other things and not, there's something that's just not working or not quite right. Have you come against some unusual symptoms or diagnosis that OT can help out with? I know there's probably some out there that people will probably love to know about, or maybe they don't even know that they have yet, but they are exhibiting these symptoms. So, kind of waiting before that volcano erupts. Is there something that you can, educate us and talk to us about some of those very kind of maybe rare or not so rare um, things that people are going through that they don't necessarily know how they can help themselves?
Yeah, yeah, definitely. So I work with a variety of different kinds of people, but um, some of my main specialization areas are kind of fits into that category you said, Rachel. So I work with a lot of people with postural orthostatic tachycardia syndrome, or POTS, which is a form of dysautonomia, um, which is like an umbrella term for conditions. Basically, it means like there's a dysfunction in your autonomic nervous system. And that's a great example of a condition, which I think is, it's actually not rare, but people often haven't heard of it. And it's been increasing a ton since COVID. So especially with long COVID, so long haulers, people who are having these lingering chronic symptoms after a COVID infection. I was reading a study the other day that up to 80% of people with long COVID actually meet the diagnostic criteria for POTS.
Really?
Um,
Wow.
yeah, so I've seen a big, that was something that I started working with during my residency, and I've seen a big jump in my private practice caseload working with individuals with POTS, because it can be very hard to get a diagnosis. There's a lot of medical gaslighting for people who experience this condition, and it can be hard to find providers who are knowledgeable in it. And yes, it's definitely a condition where occupational therapy can help. There can be a lot of impact on your day-to-day activities if you're struggling with POTS. And
symptoms of like
what are
people like,
symptoms?
yeah, what do people commonly experience with POTS?
Yeah. Yeah, so POTS is diagnosed based on a rapid heartbeat or a heartbeat that increases by more than 30 beats per minute. If you undergo a postural change, so if you were to go from like lying down to standing up, your heartbeat skyrockets, and you might feel lightheaded. Lightheaded, dizzy, like visual changes. Some people faint. You don't have to faint. You might just feel like you're about to faint. Um, but what I always bring people back to is POTS is a dysfunction in your autonomic nervous system, and your autonomic nervous system impacts your whole body. So POTS is diagnosed based off of that increase in heart rate, but there's really symptoms that can happen across your whole body. So people can experience like headaches, migraines, brain fog is really common, fatigue is very common, pain, very common. And yeah, really like gastrointestinal difficulties. So really like your whole system, anything that your autonomic nervous system impacts, breathing difficulty, shortness of breath, all of those things can be impacted by POTS.
That's so crazy. And like all those things that you mentioned, all those different symptoms, I can totally see the medical gaslighting because they're like, oh, you have a couple of these, like, yeah, like you'll be fine, do da 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 da, or there's nothing to like worry about. I can totally see
Yeah.
how that would happen. What, just out of curiosity,
Yeah, there's symptoms that can be, I feel like there's symptoms that can be very vague,
yeah,
difficult to point your finger on.
yeah,
They change a lot, right? So this is like a chronic, it's a dynamic disability, meaning that someday, like every day is a little bit different. And I think our medical system just isn't great at really supporting people with dynamic disabilities. We want like a discrete problem that we can fix rather than something that needs to be supported. Your body needs to be supported from a holistic perspective. And yeah, so it's really common for these symptoms to be written off as anxiety. POTS disproportionately seems to impact women. So there's that component as well, right? Like woman goes into the doctor. And yeah, she's kind of told like work on stress management. It sucks. It really sucks. And yeah, so I am hopeful that this is changing. I think, POTS was around before COVID. But especially I think COVID and long COVID has shined a spotlight on POTS and people struggling with this. So there is a little bit more research going into this condition, a little bit more awareness, and hopefully that helps people. Yeah.
no, that's amazing. And in terms of helping people with their POTS, can you tell us maybe a short story about, someone's kind of like before and after and like how you've been able to help them through this journey? Because obviously, just down to the diagnosis, that's difficult to do. And clearly, they've maybe been to other places and felt like they weren't heard. Do you mind sharing with us?
Yeah. 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 So I'll share about, yeah. And I'll share about a teenager
Yeah.
that I've worked with, because again, like I think this can happen to teenagers. This can happen to young people. And yeah, so I working with a teenager, a lot of headaches, migraines, a lot of ongoing fatigue that was really impacting her ability to like go to school, to learn, to take care of, she wanted to like take care of her pets. She wanted to be more active and rollerblade and shop with her mom on the weekends, right? So like all of these things that I think we look at as an OT, like what's important to you, what do you want to be able to do? And so first where I start with POTS is helping people like understand what POTS is, how it's connected to your autonomic nervous system. And that can help to explain like why there's all these, it can feel like you're chasing like all these different symptoms all the time, right? But if you can see that it's like I don't know, like the 8-headed monster, right? But it all has the same root, your autonomic nervous system. So if we can focus on supporting your nervous system, then generally that helps with POTS. So I started with education with her, like what's your nervous system, what's POTS, focused on with her, we focused a lot on consistently implementing lifestyle strategies that help with POTS. So increasing water, drinking a lot more water than people think, increasing salt and electrolytes, using compression. So so a lot of POTS, I feel like I could go on and on about POTS. A lot of it is the heart is having a hard time, blood is having a hard time getting back up to the heart. So for some people, POTS can be due to like low blood volume. So you really want to increase your water and increase electrolytes, salts, to help increase your blood volume. And compression, especially lower body compression, compression socks, and abdominal compression can help to kind of mechanically compress the blood vessels so that blood gets back up to the heart. So we worked on integrating those things, made some changes to her home environment in terms of like, if for some people with POTS, if you elevate the head of the bed, that can help with how your body is processing fluids in the middle of the night. And with this client, it was a lot about, I think when you're working, especially with a teenager, it's a lot about like, how can you feel empowered to make these changes? And how can you feel empowered to manage this dynamic and invisible disability amidst like all the other things that you're managing as a teenager? So with this client, it's like, it was a little slow, right? It was about building a relationship and working on things like one little drop at a time and like celebrating every success, and it took time. But she gradually started to feel a little bit better, feel like she had a little bit more energy. We worked on her nutrition, like the timing of her meals. So I'm not a dietitian, but I work with people on like the portioning of their meals, timing of meals, in general, working to like decrease processed food, increased like stabilized blood sugar. And then we did a lot of practical things like figuring out how, like where in her routine could like taking care of her pets go in so it would work with her energy, and how could she like pace herself throughout her school day and integrate rest breaks into her day. And then of course we did a lot of like working on building up activity. So starting with really, really gentle movements, lying on her back, a lot of lower body and core strengthening, starting like laying on your back on the ground for POTS is really helpful, just to help her grow stronger. And she's made a lot of progress. She still has POTS. POTS is, it's as of now, there isn't a cure.
Yeah.
But it's a condition that can definitely be managed and where your quality of life can certainly improve. And I want everyone to know that. I think sometimes you go to the doctor and a doctor might tell you, drink more water, increase your salt, use compression.
Yeah.
But that's kind of it, right? They're not going to help you with like the how of that, or help with like this activity pacing. Like, how can I do the things that I need to do in my day-to-day life, even if I'm feeling like crushed by fatigue, which is a very common experience with POTS. So that's a lot of like what I did with this client, right? Like, where are you at right now? What's your baseline level of activity? And how can we gradually start to make your body stronger so you can tolerate more activity and build in like a lot of rest, figure out for your body, like what is restful and how can we incorporate that into your routine? So it took time, but she's made a lot of progress. She started rollerblading. She's taking care of her pets more independently. She is able to like do more things on the weekends with her friends and with her family. Went on like a vacation with her family and didn't crash afterwards, which I always say is huge. If you can go on a vacation and not crash afterwards, like
anybody.
Yeah.
Yeah. No, that's amazing.
Yeah.
I love like not only how much you helped her, but a lot of what you described and the ways that you helped her is, I was just thinking in my mind, oh my gosh, like everyone, kind of what we alluded to earlier, everyone should see an OT because like these are all the ways that you helped her. Is like I'm like, oh my gosh, like someone needs to come into my life, everyone's life, and like help with all these things. We would love, for someone to come and tell us like how we should manage our day based on like how we feel, what's our baseline, how can we get better? Obviously drinking more water, I think for anyone is like awesome, right? Like I think we should all be doing that. I think we're all very guilty of not doing that. I don't know
Yeah.
person that drinks water well. Like, like I just don't know. And so I just loved that you were her advocate throughout this process. And I think that the world is lacking a little bit of those advocates to push us forward, to make us better. So I appreciate not only having you explain her story, but I think everyone could hear a little bit about how you can help other folks with where they are. Does it, they don't have to have pots, maybe they do. But those were all great ways just showing people how you can be helped and how you can make it through the day and actually feel fine, and how you can make it through a vacation without feeling like you need another vacation for the vacation, Um, so
Yeah, yeah, it's a great point. I think, and like I said, I'm like, I feel like so many people can use OT. And what I love about being in private practice is that I can really work with like the full spectrum of illness or disability, right? So it's like, I think that's what I love about my training as an OT too, is that like I have a lot more training, a lot more specialization than a coach, right? So like a life coach or a health coach. So I kind of can speak that medical language and understand like the pathophysiology of what's going on in a body that is managing or dealing with POTS, and then figure out like, okay, so what does your body need
mm,
specifically to support that? Which is different, right? Like we all need to drink more water, but it's a little different over on this side if you're managing that kind of chronic illness. But then, yes, like there's generalizability for like all these different things, right? Like I think especially with activity pacing, or like I work with a lot of people who are managing chronic fatigue, and that's like learning to first work within your body's energy limits so that you're not constantly overexerting yourself and setting yourself back. And it's very different if you have chronic fatigue and it's like you are literally like you literally feel like you've been hit by a truck and you're not able to move. Um, and there's lessons there, there's nuggets there, I think, for us all about how our society like encourages us to constantly overdo it and overextend and not take care of ourselves and not rest.
yeah,
So yeah, that's really, I mean, I love that about my work, right? Is that I can speak this language to people who are really, really impacted by an illness and by a condition, and I can meet them where they're at and validate that experience. Like, I hear you, I see you, I know that this is real,
yeah,
and here's what you can do. And like, if you're not at that point, but if you're just feeling burnt out, overwhelmed, overstimulated, like, your mental health, right? Like if you're on that side, like OT can help you too. So you don't need to wait until you have a chronic illness or you've gotten injured in order to start working on these things.
yeah. I love that. I think that literally sums it up perfect. You do not have to wait to see an OT. You don't have to
Yeah.
wait until it all falls apart. Something drastic happens and you're in a hospital and an OT comes into your, emergency room.
Yeah.
You don't have
Yeah.
to do it. So on that note, I would love for the people listening, if you could tell us where folks can reach out to you, where they can find you, where they can get some more amazing information.
Yeah. So you can find me on Instagram. I'm at Kristin MCOT. My website is my first and last name. So KristinMcConnell.com. I do have a Substack where I write I'm, I go up and down in terms of consistency. But so you can subscribe to that and get little love notes, letters on my professional interests, as well as kind of my personal journey and how for me, my personal journey and my professional journey, it's very interwoven. So my subscribing to my newsletter is a great place if you just want to keep in touch and learn more about me from that perspective. Um, and yeah, if you go to my website, I do offer free 30-minute consultation calls. They're a gift of my time. There's no obligation to work with me beyond that. And I would love to talk with anyone listening. If there's something in this that resonated with you, if you're something strange is going on with your body and you just want help figuring out where to go next, please reach out. I would love to be a support.
That's so awesome. Yeah, I think people can definitely take you up on that, and especially after listening to this, I think everyone should and get a little bit of idea of how they can better themselves and get through the day with a little bit more peace. So, thank you so much, Kristin, for sharing everything with us today. And I know I asked, probably more questions than I intended, but you totally sparked my interest, and just really want to thank you for being here.
Yeah, of course. Thank you so much, Rachel. It was so fun talking to you.
Thanks. You too.